Hello and welcome. Today we're here to discuss the incredible role doulas have in supporting parents when welcoming a new baby into their lives, something Trenton Health Team is working hard to spread the word about with our Safer Childbirth Cities Initiative. My name is Mitty Alonzo and I am the Communications Specialist for THT. Trenton Health Team encourages cross-sector collaboration and implements innovative projects to improve health and well-being in the greater Trenton area. Our work shifts in response to the needs of our community and our partners, and is based on thorough data analysis. Today, we'll discuss who and what doulas are, what they do, and the assistance they provide during pregnancy, at delivery, and afterward. We have a wide range of guests here with us. Let's get some introductions in.
Hi, my name is Deanna Pope. I am an advanced perinatal doula. I am a senior case manager and program coordinator for Children's Future.
Hi, I'm Daniela Moreno. I am a mom that work with Children's Future. They provide me the Doula Services.
Hi, I'm Julie Blumenfeld. I am a midwife. I work clinically in Trenton, and I'm the program director for the midwifery program at Rutgers University in Newark.
Hi, I'm Videsha Joshi. I'm the senior program manager for maternal and child health at Trenton Health Team.
Leading the discussion is Antigua Jackson, a board-certified women's healthcare nurse practitioner who is currently employed in the pharmaceutical industry, serving as a women's healthcare medical educator where she facilitates contraception education. Antigua began her nursing career as a labor and delivery nurse at Robert Wood Johnson Hospital in New Brunswick, New Jersey. That's where she fell in love with women's health, specifically caring for and educating the underserved and underrepresented. It's something she's been doing for more than 17 years. Antigua, take it away, please.
First, I want to start by better understanding this initiative and organization leading it. Videsha, so what is the Safer Childbirth Cities Initiative, and what is Trenton Health Team?
So the Trenton Health Team is a regional health hub, and our mission is really to improve the health and well-being of the greater Trenton community. And we really focus our programs around social determinants of health. And particularly in my case, it's maternal health. The Safer Childbirth Cities Initiative is actually a Merck for Mothers initiative. And it's really meant to sort of create or fund programs that are innovative, have innovative approaches in different cities in the United States that have a high maternal health mortality rate. So the ultimate goal is to create safe places, safe, equitable places to give birth.
Can you give us a sense of the needs here in Trenton that the Safer Childbirth Cities Initiative is working to address?
So let me start by giving some perspective on where we are as a state. So in 2018, the maternal mortality rate in New Jersey, we were actually ranked 47th for maternal mortality. However, in the subsequent years, that has improved, and we're now ranked 29th, which is a great jump. And I think a large part of that improvement is the First Lady, Tammy Murphy, started a Nurture New Jersey initiative. And also she and her husband, Phil Murphy, passed a lot of legislation to improve maternal health in New Jersey. So all of these initiatives together have really tried to emphasize equitable care, trying to make New Jersey the safest place to give birth in the country. That's the ultimate goal. As of, I believe it's 2020, 58% of Trenton births were actually Hispanic of any race, and 34% were Black non-Hispanic. And in 2020, births to foreign-born women comprised 53% of the city's total births, which is, it's very high. And I think, some of what comes with that is some of the newly migrated families that do arrive to Trenton sometimes arrive later in their pregnancy. So they come in their second or third trimester. And that sort of may be part of the reason that Mercer County, the county that Trenton is located in, has the lowest rate of first trimester prenatal care initiation in New Jersey. Black maternal mortality rates, across the country are terrible, and Trenton is really no exception. In Trenton specifically, Black non-Hispanic birthing people are more likely to have higher rates of preterm births, 13.1% versus 8.6%. Low birth weight, which is actually double that of other races in Trenton, and higher rates of unplanned C-sections and NICU admissions. There's work to be done. Part of Safer Childbirth Cities grant that Trenton Health Team administers involves sub-grantees that we have in the Trenton area. So one of them is Children's Futures, who are represented today. There's also Children's Home Society, who has their own doula program called Amar Doulas. Capital Health is one sub-grantee, as well as Central Jersey Family Health Consortium.
Deanna, let's turn now to how Safer Childbirth Cities Initiative in Trenton is supporting doula programs. First, what exactly is a community doula?
Let's start out with what a doula is. A doula provides supportive services from physical to emotional and even providing information that supports the client throughout the duration of their pregnancy and even postnatal care. A lot of times a client can specify where they want their doula, so not necessarily just prenatal or labor and delivery, but sometimes just postnatal care. So it really depends on the client's needs. A community doula is very special. A community doula provides information and resources to the clients that are available within the community. And also you have a better relationship with a community doula because they come from a different perspective. I always call it heart work. So the core of a community doula really specializes in that they connect with the client on a community level basis.
What sort of training or certification does one do to become a doula?
A doula can be trained and certified. There's actually many different doulas, types of doulas. So a doula can be trained and certified in perinatal care, which is prenatal and postnatal care, labor and delivery. For example, I am a perinatal full spectrum doula. You can also be trained and certified in lactation counseling services. You can be trained in reproductive health care services. Often a community doula gets all of those trainings in one.
Can you tell me when and how does an expectant mother typically connect with a doula?
Typically, for a community doula, there are community-based organizations that can link you to a doula right away at any point, it should be. And then from there, if it's postnatal care, that a community doula can lead you to effective resources that can help you the duration of your postnatal care, or even as you go along with your children. For example, Children's Futures, we service our clients for the children between the ages of 0 to 24 months. So very extensive care that you get when you have a community doula.
Julie, how does a doula work with an OB provider?
We really see doulas as a huge asset to our work. We know that they have a similar philosophy in terms of supporting the desires of the birthing person, really centering them in their care. And we know that most births in the United States, in New Jersey, in the Trenton area, take place in hospitals. And even midwives that are really focused on relationship building with their patients and centering their needs and care often are caring for more than one person at a time in the hospital setting. It can often be really busy and our attention is pulled in many directions. And knowing that a doula who just is caring for that one patient, particularly during their labor, is incredibly reassuring to us, especially knowing that we're coming from the same philosophy about supporting the patient's desires, following what they really want for their birth, and providing them education in a way that's really useful, and helping them be advocates for themselves, which is also super, super important.
Very.
Also see them as a pathway, getting people in, as Videsha said, into early prenatal care. And we know that across the nation that there are many obstacles to patients following up in the postpartum period, and we see doulas tremendous help in encouraging patients, supporting patients to not just come for their postpartum visit, but understanding the value of coming.
Deanna, what services and assistance does a doula provide during the course of pregnancy?
For one, we service the family. I think that's very important. So we try to include who that support person is. As a doula, it's it's a key component to connect with who they trust first. And while servicing them, making sure that they have a breastfeeding help, making sure that they have a plan, making sure that they have postnatal care plan, making sure that the people who support them are in on the plan. A lot of times we also serve clients who don't have that additional support, so we stand in the gap. And one of the main components to a community doula and a doula overall, doula services overall, is to come with a wealth of knowledge and information so that they're able to advocate for themselves. A lot of times people feel that the doula is supposed to advocate for you, but if you can't speak for yourself, it's not a comfortable situation to be in. So just making sure that dad is included and dad knows and dad doesn't feel like you're taking his spot. Making sure that they have all the information on policy and procedures of the hospital setting, making sure that we fill in the gaps to connect that very short-term relationship with the nurses that are there, that everybody feels comfortable.
And what about during labor and delivery itself? Is the doula present? And if so, what is the doula's role in that setting?
So we love when the midwives love when doulas are present during the labor, supporting the birthing person. We know that the often providers, whether it be a physician or a midwife, are often pulled to other patients, other obligations that they have in the hospital. And even nurses often are caring for more than one patient at a time. And the doula is one-on-one with the patient in the room, providing education about what's happening or things to come, providing physical support to them. We know labor can be really uncomfortable, and they have all kinds of tools that they use, not literally, but the knowledge they have about supporting people and helping them through that uncomfortable time. And again, helping them advocate, when there's a time to make a choice about something, whether it's, do you want pain relief, or even something simple like, do you want to be in this position, or do you want to use a birthing ball, and sort of helping them understand their options and why they might pick one thing over another, and sort of helping reinforce that they have a voice and that they can be the one making these decisions.
A key word that I've been hearing over and over is advocating for yourselves, or assisting the patient with advocating. Once the baby is born and home from the hospital, does the doula's involvement end? Daniela, you want to?
Not at all. It was like a huge support to have my doula with me in moments that my husband couldn't be with me. She was my emotional support. She provided me help with diapers, with the breastfeed, with everything that I really didn't know. She really helped me with that, with everything that I really needed.
Everyone envisions your doula being there for your birth. And then when you get home, it's kind of like a now what thing, even with whether you have support or not. So I think it's really important to understand that doulas also, once you're out the hospital, once you're home, they play a really key role in what that looks like in your transitioning for you, for the baby. Sleep is a big thing. So sometimes just someone being there to hold your baby. And we do actually have tools, like we'll bring a rice bag and, make you feel that the comfort that you physically need, bring you more information that can assist in your postnatal care so that you can physically heal better. And also making sure, again, that dad is comfortable, or dad can get some relief. As Daniela was saying, not all the time that dad can be there, or not all the time that support person is able to actually be there. So it's really good to have a doula support and fill in the gaps, bring diapers. If we have community doula, is a lot different. So if we have access to things, we will get them and bring them for you.
Amazing.
Even for the appointments.
Yes.
For the baby appointments, it was a huge support.
Oh, that's nice.
Yeah.
Amazing. So what sort of services do doulas provide in those first months of the baby's life?
Just being there is a big key component. As Daniela said, going to the 6-week checkup, we have questions. There may be some things, we have mommy brains scattered, I know. So there may be some things that your doula could say, hey, remember when you experience this, you might want to mention that to your doctor. Just being there, filling in the gap, giving new resources to see if they're okay medically and discuss with the doctor with them, and basically everything else.
So Daniela, how did you work with the doula in those first months after birth?
Well, like she said, the mommy brain. For the appointments, I talk with her and I tell her everything that was going on. And at the moment of the appointment, I forget everything. And she was the one that helped me and spoke with the doctor and helped me to figure it out about everything. And she was like a really good emotional support.
Yeah.
When I really need it.
Important. Yeah. Definitely important.
To don't feel alone.
I just want to add, I think that's so key what Daniela just said, because even just little things like navigating a phone tree, you know, when you're trying to get services and you have all these options to go through, and sometimes it's in Spanish, sometimes it's in not, sometimes it's in Haitian Creole, which we're seeing a lot more Haitian Creole families coming into Trenton as well. So just having someone to advocate on your behalf in this very vulnerable sort of time, I think is exceptional.
I have a few practical questions. Does the same doula work with a woman, her child, and her family throughout the pregnancy, delivery, the newborn's first few months, or is it a team approach where different doulas are involved?
So that's a great question. I will speak from personal experience. I always think that it's good on both ends. I'll speak. It's good to have a backup doula. I always say that sometimes your doula can burn out and wear out as well. And it's good to have a relationship with a backup doula as a client, because then you could say, hey, is so-and-so, whoever that doula, available, so that, you know, I know you were just with me last night. Maybe she can come in and hold the baby while I sleep. That's what the key components of just making sure that whatever the client needs, that we're able to work with the client, if that answers the question.
It does. Here in the Trenton area, who is eligible for doula services and who should they contact if they are interested in obtaining those services, Deanna?
Me. I am a strong believer that anyone that wants doula services should have access to a doula, and it does have access to a doula. And in the Trenton area, we are working, Trenton area and expansion areas, we at Children's Futures are working very, very hard to make sure that every mother has knowledge and to this access.
What costs, if any, are involved?
There is no cost. Children's Futures, we provide doula services to our clients at no cost.
Julie, are the doulas in our area affiliated with particular hospitals, social service agencies, or other organizations?
Yeah, so I think there's a mix in the greater Trenton area. There are doulas who work for themselves. There's doulas who are volunteers and do this because it's something they want to do on the side. There are doulas who have full-time businesses and who work in a group run by doulas. And then there are several different agencies in the greater Trenton area, like Children's Futures, that have doula programs that are funded either through grants at the state level or the federal level, so that they can provide these services without cost.
Daniela, let me ask another practical, real-world question. Many pregnant women are fortunate to have a spouse or a partner, mother, aunt, or sister support them through pregnancy and after. In those cases, how does the doula fulfill her role while avoiding stepping on those toes in terms of what family members are doing?
At the very beginning, my husband wasn't really sure about it because it was someone that we didn't know. So after meeting her, we realized that she was like a huge support, that we were going to need her. And sometimes, most of the time, my husband couldn't go to the appointments with me, and the doula did. And she was always by my side if I needed something, if I wasn't feeling right, because I had a really complicated pregnancy. She was always by my side to the ER, to the appointments that for the last weeks. She was always there to give me that support, and my husband was really relieved that I had someone, that I wasn't alone, and that I was going to be okay, because at the end, it was someone that we have really trust with her. So
that's important. I think it could be very controversial if there's a dad doesn't like what's going on.
Yes.
So it was nice that you were all able to work together for your benefit and for his benefit as well.
Yes.
Or grandma. Sometimes grandma.
Exactly.
Hey, grandma knows best.
Dana, this brings us to the role of the male doula. I think people tend to think of doulas as being females, but I understand that there are also male doulas and that in many cases they work with the baby's father. Please just talk a little bit about how that works.
I think it's an awesome concept to include the male population into this work. I think that a lot of times the male side of things when it comes to birth, maternal health and birth equity and just the male, a part of the journey and process of pregnancy and labor delivery and the baby coming are often forgotten. So it's really important to have someone in that role that can further connect as a professional in that field, in that realm. So I think that's a very special key component to the doula work. Doulas are important in general, but just to have someone who the dad or the male standing in can relate to and men hear each other a little better. Just to have someone who can better connect and better relate and that the dad can hear them better and speak to them on a personal level it's a beautiful thing.
Now we're going to switch gears to another topic. Women who should consider getting back on birth control after delivery. So I have a couple questions here for Julie, if you don't mind. One is, how soon after having a baby is a woman capable of becoming pregnant again?
So it depends on, there's some individual variation, and it also depends on whether the person is breastfeeding exclusively, because we know that breastfeeding affects return to fertility. So if someone has opted not to breastfeed at all, it can be a matter of weeks. And for someone who's exclusively breastfeeding and baby's not taking a pacifier, for example, it could be months, it could be up to 6 months, it could potentially be longer. But I will say that there's tremendous individual variation, and so there's no promises or guarantees.
One of the questions that we do have is, does breastfeeding affect a woman's fertility? And I know you touched on it a little bit, but I know there's some views on that hold up and don't hold up.
Right, so we know that in general, speaking in generalities, that people who are exclusively breastfeeding, and then I want to reiterate, this means even babies are not taking pacifiers, they're only with their suckling on the birthing person, right? That typically the return to being capable of conceiving is longer, so up to 6 months. But again, I would caution people because sometimes it's not true because there's that individual variation and then people are surprised.
What are some factors a woman should consider when deciding on which contraceptive option to choose?
So when I talk to patients about contraceptive options, I don't talk about it in terms of what is the right contraceptive method, but rather what is the right contraceptive method for them. It's really important that patients understand all the options that are available, and including risks and benefits, what kinds of health limitations might make certain methods not the right best choice for them, really educating them about all their options, what's available in their community, and what they can reasonably access, and what their future plans are, and then together in a shared decision-making process, having given them all of this information, answering all of their questions, together help them choose a method that's going to suit their needs best.
One last question. For you on contraception. When should contraception start in the postpartum period?
Right. So my answer to that actually is that it shouldn't, that it really should begin antenatally. So the postpartum period can be a really hectic time full of transition. It's a big role transition, not just for the birthing person, but for their whole family. Often people are, exhausted. They're focusing on lactation, on their baby. And it's a great opportunity during antenatal care when they're going for regular visits and having lots of conversations with their provider to talk about options and what they might want to do. Now, certainly this can change because people's plans change all the time, but certainly understanding their options and what kind of direction they might be headed in a conversation while they're pregnant is recommended.
Do doulas discuss contraception with clients? And when do you do that, prenatally, during the postpartum period, or both?
I, as a doula, do, and my doula has. I think that it is important, really similar to what Julie said. It is very important to recognize that each client has an individual process that you're assisting, right? So it really depends on the client. I'm a client that wants what the client wants. As long as it's safe and it makes sense to them, then I'm for it. I think that there is no better way to family plan than to have an actual plan. So I think, just knowing, informing them, making sure that they know to do their own research so that they have their knowledge based on their own beliefs, and making sure that we don't apply pressure to what we would have for them to do, and rather what they feel most comfortable doing. And I think there was a second part of that question, I forget.
When do you have that conversation with them?
I have it, being a doula, you have these conversations that come so naturally. So we end up talking about things even before you have the child sometimes. That's the beautiful thing about being a doula, is that you build a relationship and a rapport with the client that you just end up talking about these things. Typically, you do have the liberty to show up for them at the 6-week appointment if you want to. So if you haven't had that conversation, it should be before that appointment so that everyone's on the same page. You've done the research for them. You've encouraged them to do the research themselves. But sometimes we talk like, girl, do you want more kids or not? We're just, having that conversation. And from a personable standpoint, I've been there. So I can say that it's really good to have someone on your side that can nudge you after you haven't been to sleep. You've been breastfeeding for months, and say, what are you gonna do? It's coming, the time is coming. You need to kind of consider what your choices are.
So I hear about the education piece with patients, but how do you address misconceptions about contraception?
I think it's really important to have open conversations with patients about, so what have you heard? What do you know? They might say, I'm interested in this kind of contraceptive method or this one. And then you might say, well, what kinds of things have you heard about it? What do you know about it? And leaving it really open-ended. There's some great resources out there for contraceptive education that are public facing, that are geared towards, people in that age range at a wide variety of educational levels. So pointing people to that so they can also go home and think about these things and talk with their partner and talk with their family about, what kinds of plans they have and what might suit those needs best, can be really useful as well.
My midwifery care was amazing in that aspect, where they would text me a link to a resource of how to research birth control and what it looks like if you want to natural family plan for a little bit, and then what the actual plan looks like. So I think just having that conversation, as Julie said, is just really important.
And I like how you pointed out the educational level. I think that's very important as well.
What are the main contraceptive options available to women, and do any have particular drawbacks or advantages for a woman who has recently given birth?
I want to point out that is very medical level, and I do not do medical level questions, handle that, because that's not up my alley. I like to describe a doula as hands-on and not hands-in. So I do refer them to more professional medical level based programs, or their doctor, or whoever that practices that they see, as far as how to better recommend whatever that birth control will be, when it comes to making sure that they know how to advocate for themselves and know that they have done the research. That is where I stand in. That's where a doula stands in.
When and how can women in our area access affordable contraception regardless of insurance status? And that can be to Deanna and Julie.
Yeah, so there are numerous options. I think we're really lucky, and being in Mercer County, that it's a fairly densely populated area with good healthcare options with really thoughtful providers. So there's a big hospital system, that's Capital Health, that has a wide range of providers, both physicians and midwives. There is Henry J. Austin Health Center, which is a fabulous federally qualified health center that has options for people who are uninsured or underinsured, as well as people with New Jersey Family Care, and additionally Planned Parenthood, which is a great option for contraception.
This has been a great and very important discussion. Before we wrap up, I have one last question for each of you. What is the single most important thing you want people to know about doula and contraception awareness and how it can help new mothers and their babies?
It's very important that a doula stands in the gap for them in many ways. That's emotional, to fill in the gaps where they don't feel supported. So for me, I'll speak as a doula and as someone who has received Doula Services. Postpartum depression, postpartum anxiety is so important. And that process of making sure that the person receiving services avoids heading in that direction of feeling those feelings that you get during that postnatal period starts in the beginning, at the prenatal process.
To don't be afraid to accept the help from someone that you don't know at the very first. Because at the very end, it's gonna be someone that's gonna help you a lot, and it's gonna take a lot off your back at the moment of everything.
In terms of my message to the public about doulas would be that there's a lot of value added to having a doula, that they provide great support, education, can help you be a better advocate for yourself if that's something that you think that you would want help with. And I would also say to providers to be really open to that collaboration, that doulas are a really valuable member of our healthcare team, and team-based care is really something that can move the needle on the outcomes that we're seeing in the United States and in New Jersey. In terms of contraceptive access, I would say, there are many different options and many providers available. I think that sometimes people think that they either can't afford care or they don't know where to go to get it, and that there's lots of options out there, and not to be hesitant to speak up and ask about, where different things are available or what kinds of options there are, because thankfully we live in a county that has a lot of options.
It's always good to be open to doulas. In this instance, I would say doulas. There's many other programs that offer support services during prenatally, postpartum, et cetera. And I think the main thing I want to get across is that it's always good to sort of have these services in place and these people in place for the unexpected, because pregnancy does not always go according to plan. So it's always good to have as much support as we can possibly get to help with any of that. And then the other thing I wanted to say as far as the contraception is that I think there's a misconception, especially for us, in Trenton, that it's only available to those with insurance, those that can afford it, things like that, which is not the case. So even if you're uninsured, you're undocumented, you have very little resources, you can still get contraception.
On behalf of Antigua, myself, and the rest of the Trenton Health Team, thank you all for joining us. I want to especially thank the panelists for giving your time and expertise. We really appreciate you coming in today. It was a great, informative, and very important discussion. For more information, please visit trentonhealthteam.org or call 609-751-0421.